folks, Brian Rushing here with the Belmont Abbey College Athletics Department for another installment of the OrthoCarolina Medical Minute. Here with me, I've got the head athletic trainer, Adam Smith, today. Adam, a lot of the times, from one season to the next, we'll have certain student athletes that have injuries that require that they take care of and strengthen themselves in preparation for an upcoming season that actually spills into the summertime. And that could be an issue for you if you're not able to necessarily have day-to-day contact with these student athletes. What are some of the ways that you're able to make sure that the kids that are involved in these athletic pursuits, when they suffer an injury that spills into the summertime, that you're making sure that they're doing what it is that they need to do, and they're making sure that they have a solid plan in place to ensure that they're going to do well what it is they need to do so that they can come back ready to go?
Yep, so the first thing we want to do is make sure that we're communicating well with them before they leave school, that there's a clear plan in place of what the injury is, what the action that needs to be taken is, who they're going to be seeing, where and when they're going to be having surgery. And I think a lot of that involves the coaches as far as the timing of the surgery and the potential recovery. So if we know that someone's going to have a 6-month recovery, how does that impact the upcoming season? Do we want to do surgery sooner rather than later, or later rather than sooner? So there's a lot of considerations that we want to make sure are out on the table and that we've had a discussion with the student about before they leave for the summer, so that there's a clear plan in place when they leave, and then obviously leaving communication, contact information, email, phone number for any changes that may take place over the summer or any problems that may arise, that they know how to get in touch with me over the summer.
Now, it's conceivable, not necessarily out of the question, I would imagine, that it was going to require you in certain circumstances throughout the summer to be in touch with doctors possibly, or even third-party athletic training implements that would give you an idea of where this student athlete stands in their progression back to play, so that at the same time, when August and September rolls around, your transition from getting the student athlete back onto campus and subsequently back on the field of play is as seamless as possible.
Yeah, so it's crucial that the students bring us injury notes and any rehab progressions or any rehab notes or clearance letters, anything that they received in relation to their care over the summer. So when they go through their preseason screening, our doctors can look at that. We can be aware of what they've already done and formulate a plan going forward once the school year starts.
Certainly wanting to make sure that the continuum of care is always there for the student athlete.
Absolutely, always.
Adam, thank you. Folks, for stats, standing stories, and more, there's only one place in cyberspace when it comes to your Crusaders. That place, www.abbeyathletics.com. For the OrthoCarolina Medical Minute, this is Brian Rushing.